Or is it afternoon?
It is afternoon, but I don't think anyone is going to worry too much about that.
Depends on where you are.
That's right. That's true. That's true. Well, we will go ahead and get us started today. So good afternoon. Thank you all for joining us. My name is Tracy Sabetta. I'm a member of the Ohio Equity Team. The Equity Team is a committee of the Ohio Energy Table, funded in part by the REAMP Energy Network. The theme for our monthly speaker series is equity as it relates to environmental justice and climate resiliency. It's the goal of the team to encourage members of Ohio's BIPOC communities to be more engaged with issues of the environment and to ensure community voices are heard by our decision makers. So on behalf of the Equity Team, we appreciate you giving us your time today. I'm going to hand it over now to Equity Team Co-Chair Achilles Morales, who is going to introduce our speaker and lead our discussion today with an advocate that many of us know very well, Equity Team member Dr. Peggy Berry. Achilles?
Thank you so much, Tracy. I'm really excited to be able to introduce Dr. Peggy Berry. I first met her at a training a few years ago, and then I was doing a training actually with Chad, who is doing our tech this afternoon, and she was in the audience listening to us. So it was great to see her and to meet her and to get to know you better. Dr. Peggy Berry earned her doctorate degree in 2015 at the University of Cincinnati, where she studied the effects of workplace bullying on novice nurses. That is not all she has done. She is an occupational health nurse. She is a book lover, as I have learned to find out. She's a founding fellow of the Workplace Bullying Institute. She's a climate reality leader. And she's working on aggressive behavior towards our population and addressing how large companies and corporations are using their workplace practices that are negatively impacting our environment. She's also a member of the Alliance for Nurses of Healthy Environment. So I can go on and list all the things that she's a part of, but I'm going to let Peggy introduce herself. And I'm going to also just ask you when and why did you become an environmental activist?
Thank you, Achilles, for that great introduction. As you all know, I'm a registered nurse. I've been a registered nurse for a very long time. We won't tell you how long. But when I was growing up as a nurse, I always thought it was health behaviors that needed to change in my patients. And actually, when we talk about it, we think about primary, secondary, and tertiary care. Primary is how you prevent it from even happening. So here I am, I'm working as a occupational and safety health nurse for 13 years. For a large air freight and trucking company. And that's where I first learned about material safety data sheets, because before I didn't know anything about this. You don't discuss that when you're working in a hospital. So in 2013, I had an opportunity to go to Washington, D.C. as a member of 50 states for clean air. And that was with Earth Justice, ANA, Sierra Club was involved, the American Lung Association was involved, and I went with the Ohio contingent, which was a great woman out of OSU, Julie Wetherington Rice. I went with another person with the NAACP, another nurse out of Northern Ohio who had run for a government position. And we all went to talk with our representatives and a few senators about healthy air. So at that point, I was a staunch conservative Republican. I really was, and I supported them all the way, you know. So I figured I wasn't going to have any problems going into my representative, Mike Turner, and be able to discuss how clean air impacts the health of everybody in this nation. So we were walking down the hallway to go into his office, and all of the interior doors closed. And we were met by a young legislative aide that probably just gets coffee. But he sat down, he took notes. I told this aide who Mike Turner had missed, what our elevator speech was with clean air. And one of the reasons why I had been so sold on this idea was that my mother had ended up with adult onset asthma because of a paint factory that had moved in across the street from us. So told our stories, and as we slowly walked away, because Julie was on a walker, she needed to have her knees replaced, so it was a slow move back down that hallway. Who should walk out the door after I was told that he was down on the floor at a legislative meeting or hearing was Representative Mike Turner. And I stopped him. I gave him a 2-minute speech, and he waved us on. And I felt totally ignored. I felt that none of my words fell on him at all. And I got angry. I won't use the other word that I used. I got pissed. Okay, I was so pissed. Maybe it was because I thought I was entitled, because I was his constituent. I had made an appointment with him, and he was in his office, and he should have talked to us. That's how I felt. And when I went back home, I told my husband all about it. I told him what had happened, and I went into a Coco's Bistro, and there was a fundraiser for Mike Turner, and I said that I would never vote for him again, the people in the fundraiser, and I would work to fight for clean air the rest of my life. I joined Sierra Club as a life member, and I joined the League of Women Voters of the Greater Dayton area so that I could learn about things. There's questions? Oh,
No,
okay.
not yet.
Nope, not yet. So what I ended up doing was, again, I joined the League of Women Voters of the Greater Dayton area because the idea is not to fight against the representative or the senator or the mayor or the governor, but to address the issues. And it's the issues that are so important. So the longer I became more entrenched in this, my dissertation was on workplace bullying or aggressive behavior towards novice nurses and how it decreases well-being and productivity. Well, guys, I feel like corporately, as well as environmentally, we are aggressing against the human race by not giving us healthy air, healthy water, and good food to drink. And in the time of a pandemic, why in the heck do they turn off water? Because of inability to pay? This is inappropriate. People need to be able to wash their hands in a pandemic that is still going on when one in 500 people are dead because of this pandemic. So water's life. Okay, and we need to have that clean, fresh water. So also, I wanted to say another thing, and that is there are so many of us, like you, Achilles, like Jocelyn, like Tracy, Chad, who work in the intersection of environmental justice. And even Cheryl John Cox has helped me so much in educating me on issues. But the other side of it is when I got back from all of that, after I had been in Washington, D.C., I found out that fracking solution did not have a proper material safety data sheet. So nobody knew what was going on in the fracking solution. And so I got with people with the Alliance of Nurses for Healthy Environments, and with ohiocitizens.org, and we brought a lawsuit up into the Ohio Supreme Court to make the fracking solution transparent. And we lost because it was proprietary information. But I wish we had won, because now I know that there's PFAS in fracking solution that they use to break up the shale. And we already know that flows into the water table and is unhealthy for everyone. So where shall I go from there,
Yeah,
Achilles?
no,
It's
I
enough.
think, yeah, absolutely. I think, you do a lot of work with nurses as well, in this space. So, why is it, and why do you feel like it's also a responsibility of nurses and healthcare professionals to be involved, in environmental justice work?
Well, let's talk about nurses first, since I'm a nurse. And if I go back to Florence Nightingale, which essentially started the profession, she looked at environmental factors, especially in the health of her patients. And that was, do they have clean air? Do they have clean water? Are they getting good food? Do they have blankets in the winter? And are those floors washed, and are those blankets washed and not have fleas or other mites in it or whatever? And so when I was younger, like I said, I was taught that these things were all health behaviors, that if we had more control about what we smoked, didn't smoke, what we ate, what we didn't eat, we would have better health outcomes. But you know what? Those hospitals, they just keep growing bigger and bigger, and the people in it are getting more and more unhealthy, unless you go in for like a total knee replacement, and then hopefully you're healthy. It's the water that we drink. It is the air we breathe. People who live downwind from a coal-powered plant end up with more cardiovascular disease, more asthma. Those kids have asthma. I'm going to say it directly. I think those kids have asthma because of the particulate matter that comes out of those tops, those stove tops. I can't even think of the name. Because I get excited about this. And once nurses realize that it's the social determinants of health, smokestacks, thank you,
Yes.
Angela. Once nurses are aware, and physicians, because for a long time, physicians didn't even ask what their patients did for a living. I mean, if they were in a plant that dealt with nickel, we already know that some people are really allergic to nickel and they can't work it after a while, or nurses become allergic to the latex gloves and can no longer work in nursing, because even to walk past the latex gloves will end up in an allergic reaction of, not being able to breathe. So when we look at social determinants of health, who else but nurses, which is probably one of the largest healthcare populations in the United States, their voices are heard because they are the most trusted healthcare profession in the United States. Their numbers are there. And as we educate ourselves, we will be able to talk those issues with our governmental officials and pull in other people to talk to our government officials and try to change these things, like going to renewable energy. I don't care what they say. Gas powered plants from coal plants is not a transition. It's still a fossil fuel, and it needs to go to solar, wind, or water. I saw an article last week in the Dayton Daily News about the US getting to 40% by 2030 on renewable energy. And I would like to see that at 80%, because we need to keep those fossil fuels in the ground, period. All right. There's an enormous amount of sickness that occurs because of the arsenic that ends up in the water from coal plants, from some of the other chemicals that end up, or lead that occurs when you switch from taking water from the lake to taking it from the river, and it corrodes the pipes, and you end up with children who now have lead poisoning. So for me, it's like nurses can talk to that, physicians can talk to that. And once you have nurses on board that understand that it is the social determinants of health that are causing a majority of these illnesses and diseases now, we're going to try and make it change. We're going to try and make it better.
Yeah, and you know, when we were talking a bit before all this, and you and I hope it's okay for me to ask, but you shared a story where like these were great examples, and I think the story that you shared, I'm sorry, it was very powerful when I heard it. As you were working as an occupational health nurse, and you were seeing these things pop up every day. Outside of being able to study at school about medicine and healthcare, and being able to see all the data, you're able to see how people who are working in these kinds of plants, how their health is actually being impacted. So I was wondering if you could share more of like how you were seeing that show up, in your everyday work.
My everyday, well, okay. I'll tell you, I am a thorough believer in lean ergonomics. Okay, I'm a certified lean ergonomist, and so part of my work was to prevent injuries and illnesses from happening. But a prime example of what happened when I was working in this huge warehouse was it was cold outside, and they moved all of the diesel forklifts into the warehouse and turned them on to warm them up for the night. And you're going, that's carbon monoxide you're putting into the plant. And so we moved them outside, made sure they were underneath, and opened up all of the hangers so that they would not be overwhelmed with carbon dioxide. But I think the other thing that I was talking about was, as an occupational health nurse, I went and I spoke to a couple of EPA hearings, and one was on methane, because we were trying to get the new source rules passed as well as made stronger, because they weren't going to go to the past wells, but it was only the future wells on federal property. And we would have liked to have seen that encompass all wells so that they'd be capped, or we caught the methane and other volatile organic compounds that came through. But after I had given testimony, a mother came in and gave her testimony about how her child was suffering nosebleeds and had never had asthma before until that well had gone in, the fracking well had gone in. And then she said what the parts per million had been measured. I can't remember the number, but I was going, that's way above what any person is supposed to have in their lives, because that methane can asphyxiate at a certain level when it displaces all the oxygen. But when we look at that, I came out and I literally cried in the hallway that these people are having these exposures. And then last year or the year before, we found clusters of childhood bone cancers in and around the Pittsburgh area that is heavily fracked. And I have a problem with these sites being around schools, being around hospitals. What? There was a lightning strike at a well field and the well caught on fire. And what if there was a hospital or a nursing home nearby? How hard would it be to remove people from danger? So, gosh, I'm all over the field. I'm so sorry, Achilles,
No,
because I
you're
get
okay.
excited. I really do about these issues that I keep seeing. And as I said, I really think this is a part of aggression, a type 3 violence against the populace by governments and corporations that are not accountable to the community to keep it safe and healthy. Examples are the we have Aqua Salina here in Ohio, that House Bill 282 and Senate Bill 171. We're trying to make sure that this stuff never becomes a commodity. It's a hazardous waste that they want to sell as a de-icer and dust suppressant, and it's radioactive. And can you imagine putting this stuff on our roads, and the rain or the snow comes and it goes into our Great Lakes, into our rivers, and into our streams, and into our bellies when we drink that water. And it's all accumulative.
Yeah.
It's all accumulative. And I just want to say one thing. I'm going to say hi, Deb Muster-Gibson. She's on, and she's a good friend of mine, and she is working in the food banks for the League of Women Voters of the Greater Dayton area.
Fantastic.
And she is a nurse. So when we see a need, we try to fix it. When I was, another story, when I was 16, I was walking to work, and that was a 3-mile hike to be a busgirl for 8 hours at a pancake house. And I stopped at Steak and Shake and got myself a Coca-Cola. I don't think there was a Diet Coke when I was 16, maybe Tab. This elderly man collapsed right next to me and died. And I think that's what motivated me to become a nurse, so I would know what to do. Many years later, I was a Red Cross nurse because I saw fires in the area that needed to be, they needed food, clothing, shelter, they needed medication replacements, they would lose it all. And then there were the tornadoes, and then there were the hurricanes, and then we lost power here in Dayton for 9 days with Hurricane Ike. So we just had Hurricane Ida come through, and there's a bunch of oil spills, not only in the ocean, but on land because of Hurricane Ida. So I really want us to try to figure out how to mitigate damage to life that occurs with these hurricanes by doing more for the coastlines in terms of putting in trees or other areas where there is a border between the water and people, so there's not so much displacement anymore. We could slow down climate change too, and that is why I want 100% renewable energy. So
Yeah, I was so you basically answered the next question I had for you was, all of this, some of this can feel like gloom and doom, right? When you're in the middle of doing this work. So what is it that's keeping you motivated? But you just answered that question right there, right?
Well, there's another thing too, is you find like-minded people to be with. Jocelyn, you, Chad, who's never on screen, Dad, the Alliance of Nurses for Healthy Environments has helped. I also helped with the formation of the Environmental and Public Health Caucus with the Ohio Nurses Association. These are all like-minded nurses who have joined in to see what we can do about the environmental causes and have good community health. And so that's what keeps me going. I may not see change in my lifetime, but what also keeps me going is a 4-year-old girl by the name of Elena, who is my granddaughter. And then I have a 20-year-old grandson named Kobe, and he too is I mean, I'm going to have a great grandchild probably sooner or later.
Yeah.
I'd rather it be later, Kobe, if you're listening, but because you're only 20. But that's what keeps me going, is that I may not see all the changes that are going to promote life now, but 20 years from now or 40 years from now, maybe my granddaughter will say, oh yeah, I remember grandma was on Facebook talking about this, or whatever. I hope that my daughter-in-law shows her this, so that she's aware of it.
Yeah.
But
no.
we all have to do our part. It's like that meme I saw, people who plant a tree, do it for the future, so the future can have shade. Maybe that's what I'm doing, is I'm building it for a future where we have clean air, clean water, and people have the food they need that will keep them healthy.
Amen.
Oh, I heard an amen. Good. Yeah, we need that.
Absolutely.
Yeah.
Yeah.
And I have volunteered with Mom's Clean Air Force too, with Earth Justice, with Sierra Club. Like I said, I'm a lifetime member of the Sierra Club, and I've gotten more involved as I've gotten
Yeah. No, I
more
wanted,
mature.
I also wanted to ask you, I know that you have done work around clean water. And so if you could share more of what some of that work has been, and how you've seen how the effects of lead poisoning has really impacted our youth here in Ohio.
I am very concerned about that. And I'll tell you, when people reach out to me and I do something, I'm kind of crazy. I try to pull in as much information as possible. That's my book loving kind of mentality. I went up to Toledo and I met Alicia Smith, just a wonderful gal with Freshwater Future too. And that's when I found out about, toxic algae that had caused them to shut off water. And one particular area did not get the help needed for fresh water while that was going on. So they had developed a plan to help. But then all of this thing with lead in the water came about with Detroit. And when I looked at this, and I'm going, that's sad. The infrastructure is supposed to replace all the lead piping. If this bill's passed, it's supposed to pass all the lead, get rid of all the lead piping on the roads. And I hope they take care of the lead pipings into the house, because kids are really highly susceptible to this lead piping, and it can cause seizures, hearing loss, fatigue. It can stunt their growth, stunt their mentality. And with babies in utero, it can get them to be born prematurely, have low birth weight, as well as slow growth. And their critical thinking, because their mental acuity is impeded. They don't have the critical thinking skills, and they usually end up really irritable and more angry because they can't control it. I'm also concerned about PFAS in the water too. And we've experienced that in Dayton with the Wright Pat Air Force Base and the Dayton airport with the firefighting foams. So that has its own problems in itself, in that it's endemic worldwide. It was probably in my umbilical cord when I was born, and my kids and my grandkids, because it's a forever chemical. And I tend to think it may be one of those main things that as it accumulates in us, the higher we have in higher concentrations, we have more problems like obesity, lipids in our blood, problems with our thyroid, kidney, and liver disease, as well as cancer. So there's a health reason why I want us to prevent this for future generations, so we have a healthier workforce. And there's going to be a few of us, so we need a healthy workforce that's going to be able to do the work. And if we keep poisoning them on an accumulative basis, we're not going to have that.
Yeah, that's so important, Peggy. And I think to that point, like knowing this, what role can voters play in this? Yeah.
Okay, so you notice at the beginning of the story in 2013, I checked. That when I went into Washington, D.C., was the same year I joined the League of Women Voters of the Greater Dayton area. Because when I went in, I thought they weren't listening to me. Okay. So I was worried that it was what I was saying, not the fact that the oil and gas lobbyists had gone in before us the day before. So I've learned all of this stuff. So nurses and everybody, you need to be informed on the issues. You need to understand your politician's platform. You need to see how they have voted before. And you need to determine if this person is going to fight for the community and for the health of the community on whole. So if you're not registered, you need to register now and learn the issues, learn your candidates, and be an informed voter. And I will tell you that the League of Women Voters all over the United States are there to help you to get registered and will help you with the issues. We don't get into, the personalities. They get into the issues. And right now with redistricting going on, we are working. The League is working, and many other people are working, and volunteer agencies are working for a fair districts map. Okay, that is so important, because back in 2000, with each 10-year census, they redraw these districting lines, and they were gerrymandered so that Republicans would be voted into office. It needs to be a little bit fairer and based on the community. So register, vote, and check your registration, because in Ohio, they actually did a purge. And that was one thing that the League will help you do also, is check to make sure that you have not been purged from the rolls. So vote.
Good, yes, and look up the issues, and definitely make sure you're checking your voter registration status, because it can happen to anybody, even if you are a voter. I've had friends who have had that experience, so that's some great advice, Peggy.
And it doesn't matter if you're in California listening to this, or New York, or if you're Ohio. Like I said, the League of Women Voters will help you with that. And it's at no cost. You don't even have to be a member. Although they would like you to be a member. Yeah.
Thanks, Peggy. What do you think that as a group we can do to ensure our voices are being heard on health and environmental justice issues in Ohio?
Okay. First, I would say that this monthly seminar on environmental justice has helped a lot of people become more aware of issues that are inequitable. And let's face it, environmental justice is racial justice, equity justice, because people, corporations are known to choose disempowered populations to build their factories or their power plants in. So be aware that with social determinants of health, where you live can affect your health. Read, become an avid reader. And I would say check all your sources so that you are aware of the issues associated with environmental injustice. And then start fighting. I know, resist, okay? Resist the building of pipelines, resist gas-powered power plants, and encourage renewable energy in those areas with solar, wind, or water to generate our electricity now. Let's see. And then look to the issues, and don't go to Wiki. Wiki isn't really a great area to go into, but I would promote using Sierra Club's website, as well as other environmentally active people, Ohio Environmental Council, Ohio Organizing, ohioorganizing.com, the Alliance of Nurses for Healthy Environment. They are going to have research-based journals for you. The American Lung Association. They will help you to identify the environmental injustice areas where you live. And let's see.
Yeah, Peggy, would you say, for folks who, it sounds like, you had that interaction with your representative and you right away decided to take action in a different way and educate yourself, empower yourself to be connected with people who are organizations that are doing things. So how did you know to turn to the League of Women Voters? How did you know how to turn to the Sierra Club?
Okay. They, with the League of Women Voters, it was their platform. Check out their website too, that they promote the issues, or they will discuss and work on the issues, not the personalities. I will tell you though, I was shaking my finger at 6'5" attorneys the day I got back from Washington, D.C., telling them that I would never vote for Mike Turner again. So that anger helped to motivate me to figure out how to address the issues. And then Sierra Club helped to identify those issues in terms of clean air, clean water, and good food for people. And then the other side of it is I went and I did my PhD as an older student. I worked for a company for 13 years and we were all laid off. Now, if that's not an injustice issue, where you are laid off with 3,000 people, but it was a good company that gave us severance pay, and I went for my master's, and I did an environmental justice tour with my master's program, which was funded through the Educational Resource Center of NIOSH. And I got to see those injustices firsthand. And in my PhD, I learned more about oppression than I really wanted to learn about. But it was all necessary for me to open my eyes. I won't use the term woke, but I my eyes were opened, and Sierra Club helped point the way. The league helped point the way because their platform was clean water. Anything that's going to affect our water would be fought against, or we would actually say this is a good bill. And it helped educate me. And sometimes self-education. I mean, when I talked in Toledo with Alicia, those people had to learn on the fly for water issues, for getting things done in their neighborhood. And they are your community educators, the people who have had to really dig in and learn so that they could help with all of these issues. And we all, something we've been stuck with a pin and inoculated about environmental injustice at some point in our lives. I mean, when I looked at my mother having adult onset asthma because of the paint factory, that also was something that had inoculated me to understand what environmental injustice was all about.
Yeah.
I'm sorry.
And
Yeah, I know. And so I just keep inserting myself in situations, whether it was going to OSHA to talk about workplace violence, to running around with Mom's Clean Air Force, to going to the EPA and testifying on the methane resource rules. And it was like kind of gave up during Trump for about 2 years. I was like depressed because everything we worked for seemed to be tearing down. And now there's this Build Back Better, and you hope they build it back better, which is why we want your voices to be heard by the Biden administration and by governors and our representatives, that we want it to be built back better for our communities, not necessarily for corporations.
It definitely sounds, Peggy, like after you had that negative interaction, like you couldn't be stopped. You're just like a train that keeps on going. And it's very, I know for me personally, very inspirational to just hear everything that you've done. So I just appreciate you taking some time to share with us today. We still have time for some more questions. So if anybody has questions for Peggy, please put them in the chat, and I'll make sure that they get asked. But I also wanted to ask you, what can we as individuals do to bring people into this work? There's not everyone is going to be as motivated, or is going to be able to know how to search for everything and get the answers on their own. So how can we help people, just as our friends and family? How can we bring them into this work as well?
Well, that's a good question. That's a what we would call a deep question. Start on the individual level. I mean, if you can speak with, I don't like preaching to the choir. I think the 24 people on here are probably part of my choir. All right. One day, I was at church, and my bishop got up and was just so thrilled that an anti-abortion law had come through. And I think for me, I had approached him from the perspective that you have to look at both sides. I'm really a pro-lifer, okay? My daughter had a child out of wedlock, and I love him very, very much. But if you're going to be a pro-lifer, make sure that the children are going to be taken care of. So it's got to be the woman's choice, and I educated him on that. That's a hard sell. Okay.
Mhm.
I probably met a brick wall. But the other side is you talk to someone about filtration systems that you can't really afford on your water. So it's up to the government to do filtration on your water. Some individuals aren't aware that they have PFOS in their well water. You don't know until you start to test for it. And so Dayton Daily News did a really good job on PFOS, but as an individual, if you have someone who doesn't have who comes in with signs and symptoms, my goodness, look to their environment, look to where they live, and educate them as to what they can do to protect themselves. And then talk to them about what they should do as far as taking it to their community, to their county, and to their state. But try to do it on an individual, non-abrasive, issues only discussion.
Yes, that's great advice.
Okay.
Thank you.
I don't think I remember you asking me this question when we
I
were
didn't.
trying to do it.
I didn't.
And I'm going, okay, how do I go through this? Okay.
Yeah, but we have a question in the chat from Claire, and she's asking, and she would like to know if you know, are there any studies that link gas and endocrine disruptors to babies and obesity and disease?
Okay, well, you do know that PFOS has been linked to lipidemia and obesity. They also are talking to, and I would have to look up the reference, but there is a great site on endocrine disruptors on the internet, if you have access, that can go into all of the issues associated with endocrine disruptors. But I remember Julie Weatherington Rice, and I'm thinking some people do know who Julie is, talking about a well fire that occurred, that we had a 55,000 fish kill that followed all the way to the Ohio River. Okay. And that you follow the smoke because that will lead to low birth weight, premature births, and stillborns from being exposed to that smoke. Claire, I hope that answered the question. And if you want to email me later, I'll send you, and I know Claire too, email me and I'll be happy to link you to those resources. Okay.
She said thanks.
Yeah. So yeah, it's not good. I mean, I think DuPont used to say better living through chemistry. They were poor corporate players in the fact that they poisoned this world with PFAS. Okay, they put it in the stream. It went down the Ohio River. Nobody was really aware of it until what, 60s, 70s, took till the 70s to mid 80s before it was really widely known the extent of the contamination. And as I said, all of us have it in our blood, some more so than others. So that probably, when you can eat whole foods, eat organic, I know that's so difficult, it's so expensive, and do what you can to filter your water and stay away from plastics. Definitely stay away from plastics. The less consumers buy plastics, the less we will have manufacturing of it, and the less we will have need for fracking wells to make the little chips that go into manufacturing plastics. So,
Right.
Yeah, no, absolutely. I think
I'm
that's
sorry.
no, I think that
I mean,
that's
I get hot about these things, Achilles,
I think
because
it's
nerdles.
important.
Thank you, Claire.
I didn't know that was the word for it, so thank you, Claire.
That's the word, nurdles. I can't always remember the words. Don't ask me to pronounce the chemical formula for PFAS. I cannot do it. I always have people say, "Did you learn a second language?" And I said, "No, I have problems with English to begin with."
So that's very
So
relatable.
I can write well, but I can't necessarily speak in those big words that you expect from PhDs. I'm nurse first, and
Yeah,
I've spent my life talking with blue collar workers because that's what I grew up in, was a blue collar family. My father was a carpenter, and if we had not had the union, he would not have had vacation. He would not have had sick leave. We would not have had health insurance. So union strong, guys. We have to have good unions, and we have to have good jobs to lift up from poverty, as well as keep a middle class going. So
thank you, Peggy, and I think that's a great way to close this out.
thank you.
So guys, the importance of those things. So I'm gonna just thank everybody for joining us today for this luncheon hour with Dr. Peggy Berry, and I'm going to hand it off to our Chad, who is going to be on camera for the first time in our series,
Yay.
which is exciting. So thank you, Chad.
You're on mute.
Yes, I am still on mute, also trying to do tech things all at the same time. So I wanted to say thank you all for being here today. It is a fantastic pleasure, and it is a hope that you gained some great information from this wonderful discussion with Dr. Berry. In addition to that, I wanted to make sure that you do a couple things before you leave. One, you like and share all of our posts all over social media. Two, that you are ready to register for the next event. We have a fantastic speaker lined up from our indigenous community. Guy Jones will be speaking next month. I just looked at the calendar and I've already forgotten the date of the third Thursday of next month. But on that date, on the third Thursday, we are excited to have you join us again. In addition to that, we have one other thing that we need you to do. If you haven't done this already, for those that are still with us, please fill out the survey. We need the feedback. It is highly important for us to be able to get this feedback, to continue to give these wonderful speakers on this series. So in that, please make sure that you fill that out. Thank you, Khalees, for posting it in the chat. And if you have any questions, if you're on Twitter or on Facebook, feel free to reach out to the channel that you have been able to see this on, and or even via YouTube, and let us know how this is going, because we would like to be able to reach out to you as well, and hopefully get you in as one of the attendees to ask questions directly. Again, this is sponsored by the Ohio Environmental, pardon me, I'm going through the entire list here. So this is a Ohio Equity Team, which is a part of the Ohio Energy Table, which is a part of the REAMP network. We are greatly appreciative of everyone coming out today. Thank you again, and we'll see you next month.
Bye, everyone. Thank you.
Bye-bye.